In the realm of two other anxiety disorders that are closely aligned would be acute stress disorder and post-traumatic stress disorder. When there's a traumatic event, if you're experiencing a reaction to it, a hard reaction like nightmares, flashbacks, intrusive thoughts, inability to go near the place where the accident or whatever it was happened, then you're having acute stress disorder. That's the first 30 days after a traumatic event. The post-traumatic stress disorder means that those types of things, the nightmares, the flashbacks, the intrusive thoughts, the fear of going to the place, oftentimes a hopelessness about the future, feeling the future is, it's just shortened. You don't feel that you're going to live as long or that life is going to work out for you in this same way. That can happen anywhere from 30 days afterwards, could be a year or two afterwards. Sometimes when PTSD comes up, it's quite a bit past a traumatic event and people have a hard time tying the two together, but it's a situation where when I get people in who maybe they'll tell me, my life was great, I was doing really fine, and then 2 years ago I started to fall apart, I started using drugs, or I started acting out, or my work. I always want to know, to start with, what happened 2 years ago? Was there a change, And oftentimes there was, and then we have to go back there, we have to look at that, whether it was a really bad car accident, or maybe people who would have a stroke or a heart attack or a brain bleed, or may be even a person in their 20s that may have been diagnosed with some type of a cancer. Maybe they're older and the cancer is cured and they're like, that is long ago, that's not bothering me. But in fact, it is indeed. So it's kind of clearing that up, going back there and working on it. And depending on the level of the trauma, oftentimes if it's childhood sexual abuse or childhood abuse in general, and it's an adult, and it was such a walled-off, painful area, we have to be very careful how we open it up. I worked with one person where we only discussed the traumatic event for 5 minutes a session. That's all she could manage without decompensating. And decompensating would be that you can't manage yourself outside of a session. You can be upset post-session, but you should be able to go about your daily life and work on things. If you can't, then there's just too much coming out. It's called flooding, too much coming out in a session. I treated a gentleman who was a little bit elderly. He'd had grandchildren who told them they wouldn't see him any longer unless he stopped drinking. So he came into treatment for alcohol problems. However, in talking to him, when we talked about when his alcohol increase started and when he started to abuse alcohol, it happened quite a long time ago. And we really isolated it to his return from war and his just blockage of a lot of the post-traumatic symptoms that were coming up that he hadn't related, the nightmares, the intrusive thoughts, the guilt, survivor's guilt, and just guilt about things that he had done in war and he had seen done and not stopped. Even though that was 30 years ago, we really had to work at addressing the issues that had happened during the time that he was abroad in a war. And once we had worked on that, his alcohol use started to abate and he was able to stop drinking. So sometimes you will work with PTSD right off the bat, it'll present itself. Sometimes there needs to be some digging and looking that goes on to find what happened in the past.